Okay, this is Dr. Mark Carriage doing a video on generic structures of therapy. And I promise this is a very short video, but it points out the fact that there are generic structures, generalized structures in whatever therapy model you choose to pick. You can blindfold yourself and have a dartboard full of 1,000 different models. Pick one, throw one dart, and I can point out the generic structures of it. And so that's what this is. So as we're going into the slideshow, this is for mental health people that are in the field. This is not for kids. And so hopefully folks watching this will have some understanding of therapy. Who am I? Well, I got my own little website thing on, I don't even know what you call it, on YouTube. And so this is one of my YouTube videos. I am Dr. Mark Carriage. I've been around for 45 years. I got a bachelor's degree, just a little bit about me so you can understand the context of what I'm going to be talking about in my history. I got a bachelor's degree in it should be 79. I started in 76, but I got it in 79 at SIU Edwardsville. I got a degree in counseling in 81, followed by in 1985. Both advanced degrees are from St. Louis University, commonly called SLU for those of you not around the St. Louis area. I did a wonderful internship in counseling and psychology at Texas Tech University from 84 to 85. I had some of the best supervisors ever and a lot of other influencers around there mentoring. Um, so, at any rate, I did finish that in 1984 to 85, came back and then was granted my PhD out of St. Louis U. I spent 40 years working in corrections, off and on with different parts, but I retired after 27 years with IDOC just to take another position in Missouri. I won't get into all that. Then to come back and work part time in the prison system. So, with all that said, I currently am working in a private practice under Chad Welch, who owns the practice for Metro East Counseling, which is Metro East of St. Louis, and the Illinois side is called the Metro East. Again, for you folks not familiarized with the St. Louis area. I'm also consulting at TCI, which is in Cloquia Heights, which is again in the Metro East of St. Louis, as we are revamping and developing a new um, youth program. Okay, just to let you know, I did with my father, Dr. Peter Carriage, in the early 80s, mid 80s, to various ASH, it's American Society of Clinical Hypnosis workshops / conferences, where I met the best in the world of that era, except for the great Dr. Milton H. Erickson. Never met him. He passed away in 1980. I would have been in my first year of, first year of my graduate program. A little too young to know that I should have maybe went down there. Maybe. At any rate, I did study with a lot of people that were either his students / collaborators or people that are studied under him. Okay, I will say a lot of people have prof- professionally invested in me, and so now I'm trying to give back. I could be reached on email at mcarich@aol.com. And yes, I still have AOL, and I got a flip phone to boot. Okay, Matt Adams is the one. He's a therapist out of our office who kind of well, suggested that I get into YouTubing. I didn't even know much about it, to be honest with you. I never even been on YouTube before. So anyway, he's not in right now in this particular session, but so if they turn out bad, we can blame him. If they turn out good, we can blame me. Ain't that the way society works? I wait till I get to the cognitive structuring session. Okay, on a serious note, I really like the constructivism philosophy, the postmodern constructive social constructivism, because we construct our own inner realities. I know there's a lot of impinging, ongoing factors and stuff, dynamics that affect that view, but ultimately we construct our own inner reality. And frankly, that's the difference between folks that survive concentration camps, death camps, and such versus those that didn't. A lot of times, those that didn't constructed a reality that wasn't conducive to survival. And those that did. Just read Viktor Frankl's book. Okay, and I'm going to indicate in a minute that we superimpose our theoretical framework and our personality onto the client, which we do, hands down. Oh, you can say you're objective 100% and all that bullshit, but it's not true. There is some biasness because we are people and we do project our stuff onto the client, whether we like it or not. That's the way it is. Okay, a theoretical framework um, to me, which um, provides an organized way of viewing the problem and intervention. As Jeffrey Zeig, an Ericksonian guy, and his colleague stated, and I quoted, because I love that quote, the model is not only a philosophy, it is also perceptual. It is also perceptual in that it becomes a lens because you're looking through it. This lens tells the practitioner what to look for, respond to in the therapeutic encounter. But it's a double edged sword in that it focuses and limits viewing simultaneously at the same time. So it is what it is for one thing. It's on one side, it's good because it organizes your thinking as a therapist and such. On the other side, you're kind of you're stuck in your thinking a little bit and you project it. So the therapist then passes the lens on to patients. Now, I want to speak something about social constructivism. I didn't throw it in the handout. I don't know why. Um, maybe I was having one of those 68-year-old moments. Oh, but I was 67 when I made this up. Okay. At any rate, social constructivism is that when you're in a group of people, the group facilitates. I'm not saying group therapy. It is group therapy as well, but people in general, if you're at a gathering, interaction, the networking amongst the people create the social reality. It's a co-reality. Well, the same thing happens in therapy. I might be talking about it later in this module. I don't remember, but I have spoken about it in my other modules. And this module is actually part of the therapy series. I got 4 different series. I got the hypnotic series, therapy series. Then I got even hmm, well, well, besides the group therapy series, I'm trying to say this so I don't get kicked off YouTube because this is a professional video. One on treating and assessing folks that have committed sexual offenses. So, with that, there's 4 sets, and this is the therapy series. Okay, back to the slide. Hopefully, you're seeing the slide. If not, just again email me. Glad to send it to you. Let me know what you want. Um, so there are a number of viewpoints, number of theories, models. I think Roland May said there was like 1,000. I mean, he said there was like 300 he could find. in 1989. So you could times that times three. So there's probably a good thousand by now of documented models. Then the therapist is going to add their own twist to the model. I love it in these experimental studies where they emphasize that you got to be standard and all this nonsense. Dude, the therapist puts their own twist into the model as they're projecting their own personality. Okay, there are still fundamental aspects, hence generic elements or generic structures, generalized structures across the spectrum of therapies. So you can distill, I could tell you, pick a therapy, I could tell you exactly the elements that you're operating out of, generically across the spectrum. And so, hopefully, this module will help you as a therapist figure out what you're doing more. Furthermore, we're always trying to figure out what the hell we're doing. We want to enhance it. Okay, we're getting into the generic structures of therapy and the therapeutic process. I like that word process these days. I already really defined the word structure, so let's get into it. Case conceptualization. That's a big thing over the last 20 years. You want to conceptualize the case. These days with insurance is you have to pick a diagnosis. I'm not even going to get into that whole thing. But anyway, you want to identify the problems, the patterns, the processes, the issues, establish, you already have an established treatment philosophy and theory, I hope. If not, establish one. And develop a therapeutic contextual frame of reference. So the problem can be based on something other than, I Love Lucy or some bullshit. And so you got the presenting issues, client system, and philosophy. There's already this should be embedded in that. Then you go back to that. You conceptualize the problem, and then intervention. What are you going to do to affect change? Obviously, the client has to do the change. So, so influencing um, and also co-realities, because again, it's a social constructivism that's at play. So the therapist and the client each come together and they have their own realities. Now, together they form a therapeutic reality referred to as a therapeutic process. And so with the interaction comes this co-reality of what this session's all about. They create and form another reality via mutual influence. So the therapist is really, and I don't care if you're trying to be totally objective and all the other stuff, you're trying to influence the client to change in some aspect because they want to change. Well, they said they want to change. That's a whole nother matter, whether they do or not, and the reluctancies involved. Let's assume they do want to change. So you're trying to influence them to the point of change. You can't do it for them, but you got to set the context to launch the mission. So then we have therapeutic messages and responses. So the therapeutic message is the actual change evoking communication. Um, this is the point you're trying to make in the session, maybe. Um, and then there's a therapeutic response because the client babbles back, you babble back and forth, which creates the co reality. Okay, framing your message. So, what are you trying to do? What are you trying to drive home? What's the point? So, you define the goal and the themes of what you're trying to do. Again, that goes more to case conceptualization and treatment planning. Develop a key therapeutic message and points that you want to deliver because interventions are going to deliver the points. So then establish a effective framework with selected interventions. That's why I call my system the integrative system, which I'll definitely be doing a session on that. And there's a couple other pieces I'll definitely be doing a session on, if anything else. Because I spent 45, 50 years trying to figure this stuff out, if you count my undergrad time, um, uh, as well, since maybe 1976. But trying to figure this stuff out really seriously um, in grad school in '79. So I'm going to do a session on what I came up with thus far, which could change the next year, next month, next day. But anyway, okay, so back to framing the therapeutic message. So then you want to package the intervention to where it's meaningful, because you have to develop a meaningful context for delivery. And that is the metaphor. Metaphor is simply a symbolic representation of something, simple definition. Uh, so you want to, in the metaphor, you have the therapeutic frame of reference, which at the time I referred to as a therapeutic package. Then you have, it's all therapeutic communication, by the way. And that's the package. It's all packaged in communication because it is communication, because you're communicating with the client. And so that's why it's a series of interventions, which in a minute I'll talk about. So packaging, it has to be attractive in order to be received by the client. Bottom line. So because you want to grab the client's attention, and this is it. Now it's up to the client to be receptive or not. What's the therapeutic themes? Maybe that slide should have went before the other, but the bottom line is what the client brings to the table in terms of issues, problems, etc. Remember, they also bring in resources to resolve the problem and stuff like that. It's just not all one-sided, everything's dismal. It's what they bring to the table fully. And so therapist and client together develop the therapeutic themes in therapy. These become maybe ongoing threads in therapy, and whether you're in a therapy group, family therapy, couple therapy, whatever therapy, individual, it still comes down to some different threads in therapy. Okay, techniques and interventions. This is very confusing because there's no set definition separating the two. Really, I'm trying to, but I still think I muddle it all over the place. To me, if we have to separate it, to me, I really think they're kind of the same thing. But if we're going to separate them, a technique overall is a modality for delivering the intervention. And again, in some form of communication, because it's all communication. Interventions are to modify, interrupt, interfere, maintain patterns slash processes and provoke therapeutic type responses to make some type of impact. Quite often, I use them as the same thing because they probably are the same thing. Techniques and interventions. I was trying to make a distinction, but I'm not.